Good morning, friends, brothers, and sisters. I'd like to thank Reverend Riley for inviting me to speak to you this morning, albeit a late invitation. But I think Reverend Riley was just very concerned about the state of our nation, and we wanted to make some impact in our own family here, and hopefully we can spread these words to our community. So before I start, I'd like to ask your understanding. This is not a scientific presentation. It's just as I would speak to my family members, my mother, etc. And I also recognize that what I say today could bring some discomfort to any one of us, because each day, each week, we struggle with the fact that someone known to us, someone well loved by us, is seriously affected by COVID. So I hope you'll pardon me if my words bring you any discomfort this morning. So we know that COVID-19, the infection associated with coronavirus, seemed to have surfaced in China late 2019 and was recognized in February 2020. And within a month, we had our first case in Jamaica. And life has not been the same for any one of us since that time. You'll bear with me as I won't make any assumptions. And we just want to remind you about the infection for those of us who have never had it. But the coronavirus is what we call an RNA virus, which enters our bodies through the respiratory tract. It's easily transmittable, we know, by droplets, by just contact, handling body fluids, and by aerosols. And so even by speaking, shouting, singing, these droplets can be transmitted for significant distances. Hence the recommendations, which we all adopt, which is to wear our masks properly over our nose and mouth, and to maintain a distance of 6 feet between others. The virus, when infected, there's usually, in moderate to severe cases, a very rapid evolution of symptoms, including fever, cough, sore throat, headache, fatigue, muscle pains, shortness of breath, nausea, vomiting, diarrhea, cough, runny nose. And the loss of taste and loss of smell is a neurological complication of the virus. It means that the virus is affecting those nerves which serve those functions. We also know that some persons experience severe disease, and this severe disease results in primarily pneumonia, but the virus and our body's response to the virus causes significant inflammation that affects all our organ systems. And in our first 2 waves of the pandemic in Jamaica, what we saw were not only that persons admitted needed extensive respiratory support, but a significant percentage developed kidney failure and needed dialysis. The virus also induces or affects our body's clotting system, so that there is a balance now in favor of clotting. And so we get this clotting that is dispersed throughout the body, and again, primarily affecting the lungs, can affect the heart and all organs. And so you see that this illness is a severe illness. It affects children as well, and you would know that that is a great concern to me. We have seen children admitted with the acute infection. We have lost children to coronavirus, children with sickle cell disease, children with kidney failure, a child with cerebral palsy. And what we also know is that weeks after the child has been exposed to coronavirus, many times unknowingly, nobody knows, the child is asymptomatic without symptoms, the child can develop significant inflammation within the body, which at its worst weakens the heart and causes what we call myocarditis and heart inflammation. So although it affects children in large part quite mildly, it has the potential to cause severe disease in children as well. And we don't know to this day the effect on the baby who's born to a mother who has coronavirus. We also know that viruses are smart and viruses mutate. So everybody is contending for survival, including the viruses, and this virus has undergone a few mutations. Of most concern to us is the mutation to the Delta variant, which is the main variant in circulation with our closest nation that we interact with, which is the United States. We're an island. We can't survive on our own. We can't lock our borders. And so we know that we have travel from many countries. This Delta variant has been found to be more easily transmissible. So you would hear the minister and the chief medical officer speak about reproduction rates and so on. You're really saying that if you have the virus, if I were to have the virus previously, probably I would transmit to one or two persons. Well, with the Delta variant, it is at least twice as transmissible to others. And this probably affects what we're seeing throughout the world, throughout the US. And I believe we cannot confirm it yet, but this may explain what we're seeing with our third wave in Jamaica. I certainly have had experience of a child who has coronavirus, and so far, probably 5 persons have become infected because of having to deal with that child in a medical setting. The other concern about coronavirus, well, we would have been told before that, coronavirus affects young people mildly. And the major risk is for the older persons amongst us and those with comorbidities. Well, the Delta variant has changed that in that it's affecting younger persons, it's more transmissible, and it's affecting younger persons in significant ways. So we all watch news, and we know that there are many states who declare that they have no pediatric ICU beds because of the Delta variant and its effect on children. We have also seen in this third wave, certainly at the hospital that I work at, that younger persons are affected. So I get a glimpse into what's happening because I see certain reports, and we know that we see young people in their 30s, 40s, so younger than me, admitted to ICU, needing ICU for support for this infection. The University Hospital, in a press release this week, explained to the public that 96% of its patients with coronavirus in hospital are unvaccinated, and 4% have received one dose of the vaccine. I should back up to say that when someone requires significant support in the hospital for coronavirus, it requires first significant respiratory support. And this respiratory support requires the provision of what we call high flow nasal oxygen at rates of like 50 to 60 liters per minute. Now, I could never, prior to coronavirus, envisage that. When I have to give a child 10 liters of oxygen, I'm looking for an ICU bed. Now we are giving on our wards persons 60, 80 liters per minute of oxygen to maintain their oxygen levels. I'm saying this to you just to explain to you what the disease really looks like and its toll on our patients and families. These machines that deliver this high flow of oxygen are not limitless. I'm not speaking for my institution, but I know that.
I wasn't hearing you. The machines are what?
Not limitless.
Oh, okay.
And I say I'm not speaking for my institution, but they're not enough. I'll just say that. And they're not enough within the island. When that fails to be able to support adequately, we need those persons to be placed on a ventilator. And you already know that we don't have enough ventilators. Well, you've heard that our neighbors who have much more resources don't have enough ventilators. And I spoke about the other supports in terms of dialysis, and all the specialties have to come into support. Some people have strokes, etc. The medication that is used to try to attenuate the illness is expensive, right? So somebody, sent me a message. Is this true? Is it 200,000 that is required, or is it 20,000? Did I hear right? Because the medications are not what we call formulary. They're medications that in the past were reserved for persons with significant inflammatory autoimmune diseases that we are using for this infection. So I just wanted to share that so you could understand the toll on the person who has coronavirus. Then there's a toll on the system. So yesterday, there were no beds at 2:30 for persons with coronavirus proven or suspected at my institution. And I know that the emergency room was full of persons who needed a bed. My colleagues who treat adults are very concerned because every time we have to deal with a wave, we shift our resources from other persons who have other illnesses that require consistent care to coronavirus. So we have to be careful we don't assign all our beds to coronavirus. So if you come in with a complication of diabetes or a heart attack or so on, there should be a bed for you. The toll on our resources means that our staff has to be redeployed. What this means is that we close clinics. or we extend clinic appointments, which cannot be good for, the health of those who need that follow-up. I've had to don proper PPEs about thrice because my younger colleagues who do it all the time, they go in all the time. There's no sense by, pretending that I know it all and go in and breach. So those who do it all the time, that well-oiled machinery manages all the time. But the 3 times that I've had to don full PPEs to go into the coronavirus ward, let me tell you, it's not pleasant, okay? And so when we have our patients admitted, that care in terms of, somebody to sit and talk with you, somebody at your bedside, somebody, that sometimes, or I imagine, gets lost because when you go in, you're not spending as a doctor or nurse or a PCA more than 15 minutes at a bedside. So you're done, you're watched as you're done, you go in, you do what you have to do, you be careful not to breach your PPEs, you come out, it's a intricate procedure to remove those PPEs, you have to be observed so you don't breach, so that you don't increase the risk of exposure to yourself. And then there's the emotional toll. The hardest part, one of the second hardest part for me as an administrator last year was telling my pediatric colleagues, you're required to work in the adult medicine COVID service. There's fear. These are young people with a life ahead, with a young family. I remember a young doctor saying, I'm a single parent with 2 daughters, and I'm the main support for my mother and the rest of my family. And you're sending me to do this. I didn't sign up to do it. I didn't ask to work in adult service. But it's like war, and you have to go where you are needed. So there's that emotional toll. And then there's a real toll. We know that there are frontline workers who have become infected more than once with coronavirus, and likely from their exposures at work. I say this so that we think not just about ourselves. How is it going to affect me? How is it going to affect my mother? How is it going to affect that community that depends on me for support? What risk am I putting my co-workers at? What risk am I putting my healthcare workers at? How am I impacting the resources within the health system? Well, when we heard of the approval of the coronavirus vaccines late last year in September, we celebrated. We celebrated because we saw this as the only viable way of attenuating this pandemic. Now, just to say that vaccines have existed for a very long time, there are diseases, 53, and there are diseases that I have never seen or had to manage because of our success with vaccinations in this country and in this hemisphere. Vaccines are not about the individual. Vaccines are about the good of the community. It's not just protecting you, it's protecting everybody else. So we celebrated when we had the approval of these vaccines. And we know that we have 4 vaccines that the WHO has approved for use in our hemisphere. Now, Jamaica has a long record of success. We're leaders in the world in terms of the success of our vaccination program, and we take this seriously. So we don't have polio outbreaks. We don't have measles outbreaks. We have the occasional measles case imported into the island, but our public health team shuts that down really quickly. Although vaccines are very effective, there's not one vaccine without a side effect. Pediatricians, one of our main roles is to immunize children. And for every immunization that I give, I have to advise the family about the possibility of common side effects like the fever, the muscle-ache, the lethargy, but also some rare side effects that they're told about. Low platelets, allergic reactions, which would not be, expected. We have to give this information every time we give a vaccine. I don't want to trivialize it, but the approach to the coronavirus vaccines is not different. So the coronavirus vaccines have been shown to be very effective in preventing coronavirus infection. No vaccine is 100% effective. When I was a child, I got one measles, mumps, rubella vaccine. And by the time I was to have my first, or before my first child, I was required to have a second because we realized that one dose was not sufficient. The coronavirus vaccines vary in their coverage. And so I'm just going to speak to the one that's available to us, which is the AstraZeneca vaccine. This vaccine has been shown to prevent 70% of coronavirus infections. Anything above 60% is thought to be a good performance of the vaccine. But even better, it has been shown to prevent hospitalization and death in more than 90% of recipients. To me, the data that the University Hospital shared last week speaks to that. All persons admitted were either unvaccinated or had not yet completed their vaccinations. Now, I'm not going to hide anything. I said all vaccines have side effects. Coronavirus, the AstraZeneca vaccine, we know, you read, you have heard, does have side effects, right? There's a risk of clots associated with low platelets, which is said to occur in 1 in 100,000 cases or recipients to 1 in 250,000. So basically 4 in a million to 10 in a million people who have gotten the vaccine are at risk of that complication, which is the main severe complication. But remember I told you about the effect of coronavirus on clotting? The risk of that complication with the actual infection is more than 20 times that with the vaccine. Weigh the risks and benefits. The AstraZeneca vaccine so far is also felt to be protective against the Delta variant. So, what are we going to do? Before coming, Reverend Riley, sorry, I'm a bit sleep deprived, told us that this is the first day of the rest of our lives, right? She spoke to us about walking wisely. The Ministry of Health has a slogan, get vaccinated, get back to life. Jamaica has suffered, we have suffered individually, as families, as a church, as a community by loss. Loss of our loved ones, the suffering of our loved ones. But we have bigger losses. We have the economic losses and the threat to ongoing economic loss and we have the learning loss. We have our children who some have not been engaged at school or in a school setting for over a year. Friday morning, coming into the supermarket early to beat the crowd, and one of the young men who regularly helps me says, Doc, a true your talk, because understand, where me live, the picnic them not go school, and the boy them just need out them hand middle, and every party they're at. He, as a young person, is already looking 10 and 15 years down the road at what that is going to mean to our nation. So we also have the very high likelihood of having a vaccine that has also been proven to be safe for children. And the Ministry of Health has shared its plan to immunize all children older than 15 and those older than 12 who have comorbidities, things like asthma, sickle cell disease, and so on. Prior to last week or the last 2 weeks, I wouldn't speak to you so forcefully, but it's my personal feeling, and I tell my mother, Ruby, who is 93, I said, Mommy, what you can do from your home is that everybody you speak to, ask them if they have been vaccinated and encourage them to be vaccinated. The benefits for yourself, the benefits for our community, the benefits for our country, I really encourage you very strongly, if you have not, to go out and get vaccinated. We know that there's a blitz this weekend, so the National Arena is open today, and there are 2 locations in St. Catherine open today. You won't be turned away. Consider it. Consider it. Thank you.